50 years ago, back in 1971, the University of Washington School of Medicine founded the Department of Family Medicine on the university's campus in Seattle, Washington. We can safely assume that the department's founding chair, Dr. Ted Phillips, knew that he and his colleagues were onto something important for the future of medical education and for the quality of healthcare in the U.S. But perhaps Dr. Phillips and those who followed could only imagine that someday, half a century later, we would still be here, not only surviving, but thriving as one of the nation's top academic family medicine departments.
I think they were thinking in the long term, and I think they were thinking in the long term because they had this vision about what the communities would need, not this second, but into the future. And I believe that they were thinking hard about taking care of communities and taking care of our state in a way that was meaningful and not just academically interesting, but meaningful to the people who lived here.
The idea of family medicine did not appear out of thin air, of course. Threads of concern for comprehensive healthcare are to be found woven through developing healthcare practices in parts of Europe, the United Kingdom, and Canada in the early to mid-20th century. In the United States, research demonstrated that the bulk of healthcare occurred in the community and in the offices of family doctors, giving voice to a growing argument in favor of a generalist medicine that would counter the post-war rise in subspecialties. The passage of the Medicare Act in 1965 was essential. But by increasing access to healthcare to millions across the country, this landmark legislation brought into sharper relief the growing shortages of physicians, particularly family doctors. In the meantime, struggle was in the air, and on the streets, and on campuses across the nation. A collective call for a change in our politics, in our habits, and in how we treat one another. And so it was in response to this remarkable era of need and change, some have argued, and in keeping with what one observer has called the social reform ethos of family medicine, that the University of Washington School of Medicine would make significant curriculum changes in 1968 to emphasize a family physician pathway and comprehensive care education, and initiate the Division of Family Medicine out of the Dean's office in September 1970, which, some 5 months later, would become the Department of Family Medicine. Looking back, we can see that it wasn't by accident or by fate. It was a matter of vision, idealism, commitment, and a lot of hard work by a lot of very dedicated people. Doctors, administrators, researchers, staff, students, and residents. Let's take a few minutes to remember some of the people, stories, and milestones that have formed the foundation of UW Medicine's Department of Family Medicine, the very foundation on which we build our hopes for the next 50 years. Dr. Theodore Phillips left his general practice to become the Department of Family Medicine's founding chair. When asked years later what he felt were his greatest accomplishments as department chair, Dr. Phillips said,
"Getting the department established was the main accomplishment first, and getting it accepted."
And for the next 5 years, Phillips and his pioneering colleagues would work overtime to do just that, by creating educational programs for students, initiating graduate and residency programs, increasing the numbers, establishing affiliations, and of course, finding the money. 5 years at the helm, it seemed clear to Dr. Phillips that his goals to launch the Department of Family Medicine had been met. It would fall to Dr. John Guyman to expand on these successes and to further reach and acceptance of the department.
Ted Phillips, he had all the initial spade work to do, all the initial relationships with other departments at the university and out in WWAMI country, and he did a great job with all that with a very small faculty. That gave me the chance to further develop and work towards expanding our program, recruit more faculty, and to start the research section of the department. And so I had the benefit of what he had done. It all expanded in my time a lot, and the third and fourth and fifth chairs had the advantage of that. We all drew on the progress of the preceding chair.
As the Department of Family Medicine grew, both in size and strength, it began to organize itself by sections and continues to do so today. Though not officially recognized as a section until a departmental reorganization in 1981, medical student education, then known as pre-doc, was at the heart of the department's very creation. Its central purpose has always been to develop and deliver innovative, high-quality training to students who will serve the evolving needs of the diverse individuals, families, and communities of the WWAMI region, with an emphasis on rural and urban underserved and other vulnerable populations. It's fair to say that the medical student education section has delivered by developing important and influential programs and connections with the communities they serve, all central to the mission of family medicine over the past 50 years. As with the student education section, the Family Medicine Residency Program has been an essential component of the Department of Family Medicine from the very start. The residency runs along 3 tracks: the Northgate track, an extension of the UW-Medicine Neighborhood Clinic system; the Harborview track, located at the Harborview Satellite Clinic, Seattle's public hospital and regional trauma center; and the Chelan Rural Training track, 2 years of training at a community health clinic and critical access hospital in Chelan, Washington. The Family Medicine Residency has a lot to be proud of, from training residents in sports medicine, to training in reproductive health care and abortion care, to support global health, behavioral health, and family medicine service. The affiliated University Family Practice Residency Network was formally established in 1974 through landmark funding from the state and from the Kellogg Foundation. The network goals range from increasing the numbers of family practice physicians training and practicing in the WWAMI region to improving the coordination and resource sharing among community-based training programs. Today, the network consists of 31 affiliated programs located within the WWAMI region. As it turned out, Dr. Ted Phillips wasn't straying too far from the call of the departmental leadership as he accepted the position of director of the department's newly formed research section.
Ted started our research section 50 years ago. Research in family medicine wasn't even a thing, and yet now we have this research section that's got a great national reputation. Recognized for the work that they're doing on workforce and on patient-centered primary care research. It's really tremendous to see where we've landed with that.
In reflections written well after his time as department chair, Dr. Ted Phillips remembers Dr. Richard Smith, the creative force behind MedX Northwest, contacting him in 1970. Smith wished to move his just-launched PA education program into what was then the Division of Family Medicine. 41 years later, the nation's second oldest and largest civilian PA program would find a home as a section in the Department of Family Medicine. Operating on 5 campuses across the WWAMI region and Hawaii, MedX has contributed nearly 2,700 PAs to the over 120,000 PAs currently working across the U.S., while integrating its education, clinical care, and research efforts with those of the Department of Family Medicine. A year after MedX Northwest came on board, sports medicine was integrated with the Department of Family Medicine in 2012. In the years since, sports medicine has come to be recognized nationally for its attention to exceptional clinical care, for its groundbreaking clinical programs, for its leadership in national sports health policy, and for its sharply focused research agenda.
Talk about a section that's made research a part of what they do. They are certainly nationally known, not just for being the team docs for the Seahawks and the Huskies, but also for the work that they're doing in sudden cardiac death and concussion. They've really produced an incredible body of work.
The Department of Family Medicine established the palliative care section in 2014. But as with virtually every section in the department, the specialized work of palliative care education and training has long been aligned with the mission of family medicine. At the heart of palliative care at UW-Medicine is a narrative approach to medicine, a belief that knowing a patient's story, knowing just how patients understand their illness, and drawing a clear picture of what patients and those closest to them value most is the most effective way to help navigate their medical, emotional, and spiritual journey. The Osher Center for Integrative Medicine is the Department of Family Medicine's 8th and most recently created section. The Osher Center opened in 2018 with the strong financial support of the Bernard Osher Foundation and began offering acupuncture and integrative medicine consultation with family practice at the UW Neighborhood Ballard Clinic. Which brings us to today.
So what a year this 50th year has been. We've had a pandemic and political polarization. We've had a major reckoning with racial justice and the history of racism, not just in our country, but in our institutions. And yet, we're still poised to do exactly what family medicine has always done, which is to take care of patients in the community, and that's what we do best. We have graduated more residents from the WWAMI Family Medicine Residency Network than we ever have before. We've matched 50 students in family medicine this year. We've got major research efforts that are looking at making sure that we have doctors and medical care providers that are taking care of our communities. We continue to be at the top of the charts in terms of departments of family medicine, and our medical school is #1 in primary care in the United States. So there's a lot to celebrate.
The Department of Family Medicine at the University of Washington is well known across the nation as the premier Department of Family Medicine. The University of Washington and the WWAMI programs are known for a commitment to primary care. The Department of Family Medicine is seen as a place where our best and brightest students love to come train. It's a place where vibrant research happens. It's a place with exceptional educational programs. So across the nation, this is viewed as perhaps the crown jewel of academic family medicine.
I think the one other piece of the vision for the next 50 years that is really important is the JEDI mission. I think our goal should be that our faculty matches the community that we serve, that we're able to make the words underrepresented in medicine go away, and that we have a student body and groups of students who are choosing family medicine who are going to go and serve their communities and make sure that we're taking care of everybody, and we're doing a great job of it.